Hello and welcome. I'm Susan Mackay, and I'm delighted to be moderating this really critical conversation on AI-driven solutions for women and children's health. And it's hosted here at the World Health Summit by Acasis, an organization that helps government turn innovation into results at scale. Now, let me begin with a confronting truth. Each day in sub-Saharan Africa, women and children die from causes that are not only preventable, but they're also predictable. And these are not failures of science or tools. They're failures of delivery, governance, and our priority. And while AI has transformed finance and logistics, public health is still lagging behind. And proven tools like predictive analytics, mobile health platforms, and even drone delivery are already saving lives in Ethiopia, Nigeria, Pakistan. But most still remain stuck in pilots. They're disconnected from the systems that are serving the women and children who need them the most. Now, this is not a tech problem. It's actually a systems problem. And as a new BMJ collection launched on the eve of the summit reminds us, it's also a political problem. I don't know if you've seen it yet, but this BMJ's Transforming Women's Health Through Innovation collection, supported by the Gates Foundation, it lays out the challenge in very clear terms. Women spend 25% more time in poor health than men. Yet women's health remains under-researched and underfunded. Only 8.8% of NIH funding and less than 2% of global venture capital health investment targets women's health. And closing this gap could actually boost the global economy by $1 trillion a year and save millions of lives. We believe that innovation can close this gap, but only if we build it differently. And Jocelyn Clark, the BMJ's international editor, she reminds us innovation must be political. It must shift power and challenge systemic equality, not just deliver tech fixes. And as Farhan Jay, one of the featured authors, puts it, to achieve equitable health systems, women must be the architects of this innovation, not merely its recipients. That's why we have assembled, very naturally, a very esteemed panel of leaders. We've very much invited Fenton into this group as well. So I know he's passionate about women's leadership. So that's the lens we're bringing today. It's not going to be another panel that admires AI's potential. We're here to ask the tough questions. What will it take us to move from promise to practice, responsibly, at scale, and with women and children at the center? And I want to challenge the panel. We must walk out of this room with concrete, actionable solutions that we can start implementing from today, and we want to see the first results by December. That was Dr. Iberi's wish. So thank you very much. I'm delighted to introduce, we have Dr. Obi Ezekwesili, founder of Human Capital Africa and a former World Bank VP and Minister of Education. So thank you for all that you're bringing. You're bringing this lens of governance and accountability. And Dr. Iberi Okereke, currently Chief Program Officer for the Mohammed bin Zayed Foundation for Humanity, but formerly CEO of the African Public Health Foundation, and a leader in African agency, equity, and data sovereignty. Fenton Whelan, founder of Acasis. And Fenton brings us a very innovative delivery lens, and he focuses on what it takes to scale results across systems. And Kat Esser, global social impact and strategy leader at Amazon Web Services. And you're coming to bring us insights into digital infrastructure, but also what the private sector, what role you have to play in these solutions. And finally, certainly not least, Thundavar. We're delighted that you're Chief of Programs and Deputy CEO of AVPN, the largest network of social investors in Asia. And you're bringing us a focus on sustainable financing solutions and cross-sector partnerships. So thank you for joining us. Now, as I did say, we're going to walk out of the room with an action plan from this panel. But I want to start, the first question really is, I'd love each of you to set out what would be your vision in 5 years' time, what has become commonplace? Start with you. Oh, you need to use the mic, sorry.
Use the mic. Well, thank you very much. I think you feel like a token right now.
He's certainly not a token.
Be comfortable, because we women, we do it differently. So thank you very much, Susan. I think that, this really is a reset moment for us in the world. When we think of the different revolutions, economic revolutions, we're in that state right now. And somehow there is a prevalent attitude of not accepting that structurally everything has changed. Yeah. And so for those who are quick at recognizing this, it would give them the first mover advantage. For Africa, the technology is the best moment that we've had. If anything happened in the past with the agrarian revolution, we were outside of it. With the industrial revolution, we were outside of it. But with the ICT revolution, we are not just, recipients or consumers of it. We now have a younger generation of Africans that are participating in producing solutions. And so understanding that this moment is the moment that resets the kind of approach that we're taking to solving wicked problems, as they were, is a good one. And so the first thing for me is the ability of the political and policy leaders to understand what this moment signifies. And so when we discuss AI-driven solutions for women and children's health, I would say the first thing is to actually get the people who are making the decisions with all of the public money and the public power to understand what we're talking about. So knowledge within government is trailing innovation. And we've got to close that gap in ways that would give us better outcomes. The second thing is, as we think of AI solutions and we think of digitalization and all of the things that they offer us, we have to recognize that there is a state of preparedness and readiness that is necessary. So are the digital tools also able to operate as the infrastructure necessary for actually using AI-driven solutions? We've got to analytically identify what those gaps are in order to fill them. Because if we don't, then what we would do would be frustrated, because people have computers, but they actually don't have the solutions that the computers are supposed to bring. My final point is, it's become very obvious through technology that Africa is a proof that the markets can work for the poor. For a very long time, there was that attitude that all you needed to do was to be socially, distributing poverty to the poor. Now, we understand that through access to the smartphone, you have already breached a huge barrier for the poor. And the poor are using the smartphone as really the most important asset for living. Now, we have to find a way to push this to the top of the agenda, public agenda, where both the policymakers, the regulators, the private sector, and the poor are really finding the various levels of solutions that they bring. And that, for me, would be my idea of a dream world.
That's very exciting. That is very exciting, and it's wonderful to turn to another African leader. Dr. Aberi, what do you want to use this reset moment for? What's the vision you're setting out?
So, first of all, it's not fair to make me speak right after Dr. Ovie. That's just not fair. So I want to state that now, that my position is everything she said. However, since I'm here, I might as well use the mic. So thank you for the opportunity to participate in this conversation. There's and if you watched any comedies that claim to have somebody that's African in them, there's always somebody who starts with, there's a wise African saying, and there is one. It says, "You cannot shave my head in my absence."
Yes.
And with AI, with digital innovations, with all we're doing in health policy, we are trying to shave women's heads and young people's heads in their absence. And that is the foundational flaw. You've mentioned that the solutions are there. Are they? Really? We weren't part of the design. How do we know it's going to work for us? And that applies whether it's AI, whether it's, we've just mentioned how democratizing smartphones are, but everywhere in the world, and mostly in Africa, women have a disproportionately lower access to those innovations. We're not part of the design of the so-called solutions. Our data isn't feeding the AI gizmos that are supposed to solve things for us. So first and foremost, if we're not part of the solution and the conversation and the design and the leadership of those solutions, they are not solutions that would make any changes to our lives. So my first position, and if you wanted something, and I don't think I want to wait 5 years for that, I don't want 2030. Like I said, by Christmas, I would like to be in a space where every initiative that is trying to bring AI to solve health problems starts from, includes, and ends with the voices of those who are not in the rooms today. This is an atypical panel, as you all know, and that's deliberately so. We're making the honorary member. That's how most women feel in most panels. We usually get one token woman. But it isn't that we don't have opinions. It isn't that we don't have the skills or the qualifications. It's just that the system has traditionally not actually even considered women, and even not just in the science, in tech in particular, women are still underrepresented at all, and definitely almost absent in the leadership. So if we're not part of asking the questions and answering them, the solutions you produce will not be solutions that work for us. And then one other comment that I make, and this is a personal view that may not be shared by others. So this talks about women's and children's health. And if I put it in Africa as well in that context, this is something that really frustrates me, is the infantilization of a whole continent. The panel that was in this session earlier talked about, and this was unfortunately an African colleague, a dear colleague and friend of mine, talked about the baby growing up and adolescence and everything, and we are not babies. This is a continent that is the oldest continent in the world. We have skilled people, we have agency, we have views and skills to contribute. We don't have to, and I actually think we need to stop thinking about, oh, everybody, let's get an African in, complementing. We need to start to design and lead these solutions on the continent. We women need to build our own tables and invite Fenton to join in. And much as, yes, it is the part of the rationale for combining the conversation about women and children is that most of the care of children, unfortunately, even in the 21st century, rests on women. Nevertheless, so long as we continue to do that, we excuse men from being part of the conversation about solutions for children. And we need to stop that. So by Christmas, I would like to see, because I'm not doing 5 years, I might not live that long. I would like to see very clear that the youth those children we're referring to there, they understand the technology more than we do. Where are the convening fora for their views about how this technology can improve their health? It shouldn't have to rely on women and the child. And it shouldn't have to rely on a European Global North-led initiative that solves a problem for Africa. The Accra Summit just a few weeks ago talked about health sovereignty. That isn't just about budgeting, and budgeting is core, but it's actually about leading and defining the solutions that we want for our own continent. I said I was going to be a bit mischievous, so thank you.
I had an idea. I had an idea this was going to be an exciting 90 minutes. So I now throw the ball to Fenton.
Excellent. Well, first, thank you for letting me be the token man on your panel. To Susan's questions, I have two dreams. One, I think, picks up on a theme that we've heard already, which is I hope that this is a technology that emerges at scale first in Africa. And I think we've seen that in things like mobile money, where unencumbered by legacy systems, legacy mindsets, and so on, the first examples at scale were in places like Nairobi or Kinshasa, not Berlin or London. And so I think my first hope is that we build on what my fellow panelists have already been saying around building this in Africa first. And then the second is something more specific around diagnostics, where, and this isn't true of all diagnostics, but where we've seen often that the technology is cheap, but the barrier to rolling out good diagnostics, be they ultrasounds or x-rays or even humble stethoscopes, is the talented people who can read those diagnostics. And what we're seeing, I think, now is AI-driven solutions which make it possible to do that at scale in rural areas. So I think my second dream for the next months or most years is that we can see a massive uptick in diagnostic availability across the continent driven by AI.
Thank you, Fenton. I'm very excited about what you're going to say, Kat. The floor is yours.
Thank you. So honor to be here and have this conversation with all of you. Thank you, Fenton, also. So I would say in the context that I have the privilege of working in around AI and technology, 5 years is a long time, I agree. So I'm gonna fast forward it, maybe not till December, but maybe within the next 6 months or so, which is how that we try to support organizations all over the world that are actually working for maternal child health, specifically in sub-Saharan Africa. And I would say yes and yes to what you both said. From the perspective of bringing the voice of the women and children in, that's incredibly important. And I think that can sometimes often get lost. And so when we have the privilege of supporting different organizations, it needs to start there. And technology is just an enabler so that women can actually have direct access to health. And so what I'm really excited to start seeing is where it's by Africa, for Africa organizations that are coming together cross-sector, and they're bringing in the government that is actually helping to fund and sustain some of these things that are coming from some startup organizations, where it's starting in one country. Specifically, one example that I'll share started in Kenya, and it quickly spread using technology. But because the voices of those women were actually at the table to start. And so something that seems as simple as a pregnancy can be very complex. And so one organization that we're very proud to support is Jacaranda Health, who actually started in Kenya, helping moms, where there's a third of infant deaths alone in that country, being able to provide a simple way to communicate with caregiving that is at the most simple level for their pregnancies. Being able to directly have clinical care being given without having to create more clinical care workers. And so I would wish for the next 6 months, or maybe by Christmas, where we're seeing more of these cross-sector partnerships come into play. Not just talking about it at the conceptual visionary level, but actually bringing it into real world, where you're seeing private sector, you're seeing government, nonprofits all come together, but centered around, in this case, women and children, and having that voice at the table, because those children are gonna actually use the technology better than the generations now. So it's also a multi-generational approach to bring to real world.
Fantastic. Yeah, very important. And the floor is yours.
All right, so now I have to go after all of them. So I think for me, it's two things if I think about what's my wish for the future. One is around solutions thinking and design and everything they said. And the other is financing, and when we think about financing. You know, I'm a mother of a toddler. And I came here on a Saturday morning, leaving my toddler at home, making sure everything is taken care of. He's going to, he has a medical appointment, da da da. I have a very, very strong support system at home. I'm very lucky, and a very good kid as well. Now, many women don't have that. Some figure it out, some just muddle through without the support, and some really struggle, but all carry a really heavy weight with them. And you know, when you have a baby, everybody tells you, oh, it gets better with time, it gets easier with time. I don't really think it gets easier with time, but it gets different with time. And so I think in terms of design thinking and talking about solutions for women and children, it's really important to keep, I think, two principles in mind. One is looking at physical and mental health. And I think the second is really looking at continuity of services and care through the life course of women as they evolve and as their needs evolve. So everything that you said in terms of putting women and children at the center of our design thinking, but just a little example of what that could look like. And I think when it comes to financing, I've worked in banking and financial services at grassroots nonprofit organizations. I now work in Asia's largest network of social investors. And I do find that solution providers and funders speak very different languages. And I would really love for us to all start speaking the same language. Those are my wishes.
Thank you, thank you. And that point about, I think we are starting to get consensus about what we want to build and what we want to walk out of the room for. So one thing, I'm just going to go straight to Fenton, because one of your areas of expertise is learning how to scale. And so I want to, you know, what have we learned from past kind of pilots and the kind of things that you've doing? How could we break through and make it different this time? What are your insights?
We could talk about that for a long time. I think two, though, thoughts that come to mind. One is something I think you've heard me say in the past, that what gets measured gets done. And one thing I always found very powerful was the World Bank's Doing Business ranking, and how for decades now, ministers have constantly asked, how do I do better in the ranking? And I wonder if we need to think of some similar tool or index for measuring how well countries are doing, taking advantage of the new technologies that we're seeing emerging through AI, and some way of getting countries to compete to be top of the index for AI adoption, whatever that might look like. And the second is obviously funding. And you need to learn quickly what's working. You then need funding to quickly follow those things that are working. And certainly in the health development sector, we're still in this paradigm of this year we come up with a plan, next year we allocate funding, the year after funding starts getting dispersed, you know, then maybe 4 or 5 years we start seeing results. And so I think the other question for this group might be, how do we replicate the sort of funding cycles that you see in the tech economy and in industries where AI is already making a difference, where funding follows by Christmas, not by 5 years from now?
No, thank you. And I think that what gets measured gets done point is so critical. And if you've ever seen Fenton in action, some of the ways he's able to visualize that is really powerful. And I want to link that. I'm going to come to Dr. Iberi. What will it take to make sure that African governments are owning this and doing this from now? What do you see? What do we need to do differently to put ownership in African government hands?
And thank you. So African governments are like any other government. Governments are elected or people run for office in democracies because they believe they have something to offer to their electorate. It's the same whether they're African, European, North American. That is primarily the driver. The challenge for African governments, perhaps, are working in a space that is slightly more challenging, more constrained, not just fiscally, but in terms of agency and autonomy and the ability to do things. And also, in some cases, working from a very low base in terms of development and on the other side, a rapidly growing population. So having said that, what does a politician in Nigeria, I'll take Nigeria, Obi and I are both from Nigeria, pure serendipity. One in 4 Africans are Nigerian, so. What does my Minister of Health need to make sure that AI innovations are part of his solution? First of all, to understand what AI offers. Because I was in a workshop a few months ago where we had some tech people and some public health people, and I was moderating, and after the first session, I actually went to the organizers and said, we have 2 halves of the room speaking different. They're not talking about the same thing. And that was the thing about the understanding of what the technology offers. Was actually quite, public health professionals were a bit behind in understanding technology. So first thing is actually to make sure that your politician understands what AI offers. And he understands his responsibility as the health minister. Unfortunately, still too many men that are ministers, not enough women. And this, I will keep going on about this. Women need to be in leadership. Understanding what then does AI help him do better with the resources he has. So the first thing is actually to ensure that we move from buzzwords and everybody has AI in everything they talk about, to actually really understanding meaningfully what change, what can I do more of, have better impact for the little money I have with this technology? And what do I need to make sure that the technology is successful? I don't want another hackathon. Every month, every year, there's a hackathon. That's not what we need. We really need to say, okay, what the technology needs to follow the problem. What, Minister Pate, are your problems? In the maternal, in women and children's health, Nigeria has the highest burden of maternal mortality in the world. So first thing is, how can your AI solution help me to address that? Then, because he has this ambition, and I'm just using him as an example, to invest, this is his priority. How does that add multiplicatively to what I traditionally do? Because we've been addressing maternal mortality in Nigeria for decades, and it's still not improving. So tell me how the solution makes it, your offering makes a difference. And then what do you need from me to make that happen? And he needs a cross-government approach, because the data that you need to build those models that will be effective are not just sitting in his ministry. That continuity to make sure we move beyond pilotitis to actual system-embedded solutions. So that dialogue has to happen. And this week alone, I must have had at least 6 emails of people saying, I have an app, I have an AI. I'm not the person you need to be telling. And if you've already created the app, then it's probably not right for me. So as a government minister, as a leader in systems, you need to hear me first. What are my problems? And then you articulate your solution, and we jointly look at how we implement it. That would be my assessment there.
Okay, and thank you very much. Thank you very much. And that makes me want to go to you, Kat. What can the private sector do differently to address this need? Have you got something to bring to Dr. Aberi from the private sector?
I hope so. I would say everything that you just summarized, we have to work backwards from what the problem is that we're trying to solve. And starting with ministries of health is one aspect of it, but then also starting with the communities and individuals that the problem is actually living in to work backwards from as well. So having this day one mindset, or being able to think, yes, we've been trying to solve for maternal child health for a very long time within this community, but how might we then do things differently than how we've been trying to solve it? And what is the impact that we want to show? And so what is the goal for the lives impacted, right? And you start with the lives impacted, you end with the lives impacted. And like I think I'm hearing a renowned kind of common theme here that technology is just an enabler. And just having technology for technology's sake, it can work for a little while, but understanding the problem that it's trying to solve and using it at scale with all of the right stakeholders is what I would say is a different approach than creating the solution first, starting with the problem, which is sometimes harder and not as sexy to solve for, but it's more important.
Okay, and that makes me want to come to Obi, because you are a master at getting stakeholders around a table and getting problems on the table. What do you feel needs to be done now to make sure that this is with women and children, and particularly also the political accountability for this?
So I'm being very educated by every one of you. So thank you for being such great panelists. I think that number one thing that I take away from how we're discussing this topic is the necessity for us to acknowledge that AI is not an end in itself, and that the fundamental problem of the health sector doesn't vanish because we suddenly have AI. And so health system strengthening is at the heart of the effective adoption of AI. If we don't get countries to still prioritize the necessity to do the brick and mortar development of functional health systems, it would be like trying to build something in nothing. And I understand disruptions happen, but I don't think we can just sort of look at AI as disrupting the need to have a health system that's functional. If we're going to get scale in the use of AI, we have to prioritize for countries the need to do the investment in bringing the things together into a system. Because AI functions better when there is a system. So that's number one. Number 2 point that I took away listening to everyone in relation to your question about bringing people together to solve problems is that a clarity of incentives for each of the groups that need to sit at the table would be necessary. You know, if we don't clarify the incentives, then you're going to get people to the table and you would still have misaligned incentives, and therefore you wouldn't get effective cooperation and collaboration. And that's something that we really need in order to advance the outcomes. And my number 3 point is we actually have solutions that we're not aware of. So, you know, just a smartphone in a village can already bring the ingenuity of the human mind to that community. Who is taking responsibility for finding the ways that people are already using their smartphone to leverage the available scarce resources, whether it's in terms of a health professional that is many kilometers away from them, and yet they are aware of their presence, and therefore they are using that person. So we do need some kind of work that surfaces as much as possible how people are already solving problems using digital devices and solutions. And my final thing is we cannot substitute for government. Every time I see us sort of like trying to substitute for government, I say it's a waste of time. We've got to have effective governments. And, you know, those of you in the health sector, I'm going to dump a little bit on you now. You have a tendency to burrow your head into your narrow spaces of, we want to make people healthy. And a whole lot of other things are going on around you, and you're not paying attention to it. So we do need to get that level of behavior modification on the part of the health sector people, understanding that good governance is an essential context within which you can then do sectoral performance at its best. So what am I saying here? I think that in terms of politics and policy and how they come together, your constituency needs to pay more attention. You know, you can vote jokers into government and expect that, you know, things will work out in health. How? You're going to be talking to jokers about AI solutions? They'll just look at you and say, what is AI? You know, so it does matter that into the conversations now we need to build in, you know, the whole leadership question. The leadership question. We have to transcend. Some of you would have to stay in your orbit, right? But we do need to have politics that is healthy for health issues. We need politics that is healthy for health issues. Today's politics in a lot of the countries on the continent is not healthy for health issues. Do you know why? Because the rich and powerful buy their health services and then abandon public health to the poor. And the public health is not serving the needs of the poor, and there's no accountability for the failure to service the needs of the poor. And so because you care for this sector, you now need to elevate your voice. The last final thing is, I hear a sense of urgency. But where is that sense of urgency coming from? It's coming from people who don't have the levers of power to make that urgency happen at scale. You can do some good pilots, but that's nothing. You know, this pilotization of development is a waste of time and resources. And so we've got to, if we're going to get things at scale, we need a sense of urgency to basically define the way that those with the levers of power are looking at these kinds of solutions. And because we know that the Gen Zs are thirsty for change on the continent, they've got to be our best friends.
Oh, thank you. Thank you. Thank you, Dr. Obi. I think it's this, we have to focus on what is important, which is leadership, systems, accountability, and not allow this to be a distraction. And so I think that's something we really want to take out of the room, and how do we bring that in a more concrete, doable action. And I'm going to also turn to Dun, because one of the things that people are struggling for at the moment, and which can be very distracting, is a funding question. So what do you, and I know you have very deep grassroots experience, which excites me about you being in this funding space. What is your sense about where the opportunities are to help us get political leaders on board that there are ways of funding this work and making it happen?
So I think before I talk about funding and scale and political leadership, I really have to make a confession, which is that when it comes to AI solutions, I'm admittedly an AI skeptic to cautious AI optimist, right? So, and I make this point deliberately because I think it's very important when we talk about scale up and, you know, the need for finance, the urgent needs, etc., that we're moving this along with responsibility, with intention, with patience, alongside the recognition of the need, the urgency, and the, you know, action and the ambition. So, you know, I'm also reflect back to my days of community health, right, where I've run community health surveillance, going door to door, tracking women and children's health, carrying the clunky weighing scale, and thinking how in the world am I going to do these measurements? And eventually, digital scales came through, and we magically suddenly had all the data on a USB stick, where previously we were using pen and paper, and the rats were eating the records and all of that, right? And those digital weighing scales were revolutionary. They were completely game-changing. They delighted us. But also in the community, what happened at the same time, I had my office window broken, and I was threatened at knife point by young men from the community who felt those digital scales were bringing to light issues that were private. Right? So that is also the reality of uptake, of community engagement that we need to be very, very cognizant of and responsible around when we talk about scale and pathways to scale. But coming around to finance, I think the interesting thing with finance is, there are many different models that can help to move away from pilots or to help advance from early stages and more risky stages to stages of growth and scale, and draw the attention of leadership, right? So when does an initiative become interesting to government? If you talk to the government of India, they're not interested in pilots. They don't really, they're like, okay, that's cute, keep doing that. But, I'm dealing with hundreds of thousands, right? I mean, your pilot has registered 5,000 newborn babies. Wonderful. India has 67,000 babies born every day. Talk to me when you've got a solution for that. So I think financing can get the right kind of attention when you've lined it up in time. And I think what's really important when I talk to innovators and solution providers on the ground is really think about finance from the get-go. So, you're thinking about the solution. Either you're a techie coming at it from a tech angle, or you're a health professional coming at it from a healthcare angle. But think about your pathway at the very beginning. Is there a revenue model behind this? Is there a potential partial revenue model here? Because that's your finance pathway to scale. Okay, that's not available. There are other, it's not bleak, there are other opportunities, right? So there is, of course, the use of innovative financing models. And in Asia, we're seeing a lot of interest from funders, be they philanthropists or impact investors, in innovative financing models. So, for example, development impact bonds that can actually link finance to the delivery of health outcomes. So I was involved in the development of an impact bond called Utkrisht, Maternal and Health DIP in India. And because we were able to unlock finance, the finance came from philanthropy, actually. The ultimate outcome payer were philanthropists. But because we had that pathway and we knew what the financing model looked like, we were able to help small healthcare organizations across the entire state of Rajasthan to adopt accreditation standards of the government of India, the NABH and Manyata. So that was tremendous because it gave us that leeway to operate and to get where we needed to, knowing that the finance had been secured. Other models include, you could use typical traditional financial instruments like equity and debt and convertible instruments in creative ways to support social entrepreneurs. And I think it's really important to understand, and this is important for both the entrepreneurs and the funders to understand, that there are financial instruments that are fit for purpose. So look to equity, concessional debt at the right stages of growth. Equity is appropriate for the risky early stages, those really proof of concept stages. Debt, impact loans for a later stage of growth. And both the funder and the innovation provider need to understand that, because if you fund irresponsibly, you're creating additional stress and strain on the recipient of your funding. So I think innovative financing is a really great pathway to scale, but needs to be looked at critically. And blended finance, another area that is really getting attention, particularly of philanthropists in Asia, is the area of blended finance and the use of philanthropic capital to de-risk the commercial investment coming into healthcare and other social impact areas. So I was involved in the development of an outcomes fund, which was a $100 million fund called the SDG Outcomes Fund, where 80 million came in from investors, and this was mobilized through UBS, so the actual banking arm of UBS, the asset management arm. And 20 million was a de-risking first loss tranche mobilized from philanthropists by the UBS Optimus Foundation. So that was philanthropy that brought in 80 million for health, education, climate, etc. in low middle income countries. For the philanthropists, if they had done a project with just their 20 million, they'd have achieved X impact. But because they went into a blended finance structure, instead of going it alone, they unlocked $100 million of impact. For the investors, they may have never invested in healthcare in Kenya if the philanthropists hadn't de-risked it. So those are some interesting models and pathways that we can use to unlock capital at scale to then get the political attention that we're looking for.
I'm feeling the energy crossing the room here, so I'm hearing possibility. Exactly. So what I want to say now, like, where's the entry point? Where's the entry point? Where can we start to move this discussion differently? Anyone on the panel got any ideas about?
Oh dear. Where's the entry point? There are multiple entry points, but bringing it to today and the conversation that's going on now around global health, the recent political decisions that are being made globally around funding, the opportunity those decisions have made for us to actually sit back and look at the system and the global health system, the architecture that and how we actually optimize the efficiency of the investment we do have. The opportunity and expectation and requirement for the leaders of the countries that have been traditionally described as donors. And in a session earlier, it was mentioned that these donors are also donating. They contribute to the cost. Gavi and Global Fund, they co-finance these solutions. So looking at them as just recipients of other people's donations is actually reductionist. So they are part of funding the solution. And the conversation now is how do we actually bring that agency to the fore? So there are a lot of countries now, and specifically in Africa, that are looking at developing proper cross-government health strategies, health plans, and therefore expecting partners, whether they're in the private sector, traditional donor countries, solution developers, to align to that one plan, one budget, one M&E system. I think that's really important entry point is AI has to be part of that strategic, that cross-government, cross-country, cross-region in some circumstances, strategic plan. So what you have to offer, you start the conversation, like we said, talk to the people who are responsible, talk to the people whose health you're trying to improve, and then align your offer to that. Whether you're looking at it from a financing point of view, those solutions that you described are so apt, and if I might just divert slightly from the question, I work for the Mohammed bin Zayed Foundation for Humanity in the UAE, and our ambition is exactly what it is. We de-risk investment in either new innovations or enabling innovations that have been tested to go to scale. And we do that. We don't ever fund anything alone. It is always in partnership with other philanthropies, with private sector, with government, because we recognize that the fiscal solution has to be multifaceted. And we primarily work with governments, because if you don't work with governments, it's a pilot. If you really want to change the system, you've got to understand and support the government to actually adopt and scale those solutions. So that was the diversion. But back to the question about where we get in, I also want to come back to the focus of this panel, and we talk about women and children's health. Women spend less than a quarter of their lives in their childbearing ages. And that is almost all the conversation about women's health focuses on that small window. And not all women ever even go through that. But we also know that women spend 25% more of their lifetime in ill health. So there are other health problems of women that I need to be looking at the AI solutions to. Is there an AI solution for PCOS? Is there an AI solution for endometriosis? Is there an AI solution for osteoporosis of aging? I want us to start to think about the life course, the whole spectrum. Women are not just reproductive machines. They are total parts and agencies of the society. And therefore, if you're asking me where the entry point should be, let us see the whole woman and her role in society, not the role we've assigned her, but the role that she does and can play. Thank you.
Absolutely. Absolutely. And I really want to come to Dr. Obi because, I love what you said about Africa benefiting from this revolution in a different way. And I want to be even more specific. How can African women, how can we use AI to make sure that the whole woman's agenda is taken seriously politically in a way that it has not been before?
I believe that we do have to take the demand side of the conversation on AI to the top of whatever we do. I think I like the idea of government effectiveness, but we now know that government doesn't wake up saying we're going to be effective. There has to be... They wake up in Europe saying they're going to be effective. So there has to be a demand pressure for that effectiveness. And so when we talk about the women and children, I think we then have to add, and the young, the youth. Europe is average age 44 years. Africa is average age 18.9. You see, it's incredible. For every 50 young people in Africa today, there's just one old person. For every 50 old people in Europe, there's just one young person. It's incredible demographic pivot that we've seen around the world. And that, therefore, should factor into the way we're thinking of the role of women in actually defining this agenda. Because in that demographic that you see, half of that population is women. And so if for every 50 young people in Africa today, there's one old, there's 50 young people in Africa today, there's one old person, it means that 25 of the 50 are women, and they are young. So that means when you talk about the whole life experience, they actually have to be the ones that are saying, hey, if you don't see us, we see ourselves. And we're going to define the kind of agenda you're putting forward as government. So that demand side pressure is something that we haven't done well. We're not sophisticated in a sustained build-up of citizens' demand for better. And in health, it is worse, because people just sort of find solutions from amongst families. I mean, you have now where people just come to the internet and say, my daughter is sick, and we need to go to India, and we're trying to raise 5 million naira, and everybody says, okay, I give you 10,000, I give you 20. That's not the way we're going to solve this problem. So we better use their experiences as a basis to get them to begin to have collective voice for the way to solve this problem. Because government doesn't suddenly become effective until the pressure is put on government to become effective. So citizens' advocacy for good health outcomes is important. The second thing is that we keep saying that the financing for health is sparse and that it is too fragile and little. But even existing financing for public health could do better. So evidence-informed resourcing of the health sector is so crucial. Now, this evidence-informed, effective and efficient use of existing health resources will also not happen because suddenly the people in health decided to be nice to the population. It has to require a demand on the side of the people whose money is being misallocated and misappropriated, as some of the cases are. So if you looked at all of that, and I loved the point made by Fenton, you know, the doing business ranking of the bank. I was, as VP for Africa region, at the center of the use of that tool, and it worked phenomenally because the presidents felt this is infra-dig that a little country by my side is high on the ranking, and then you people put me somewhere down below. And then I said to him, there is no putting you down below. You went down below yourself. And, and now, if you are interested in leading the process of taking you up, we are ready with everything to support you in that process. So that ownership of the agenda, if we find ways of triggering it, because implicitly, the presidents don't want to be outranked by other countries. So that could be one takeaway from here to sort of say, if we cut it in little pieces and said, okay, let's take 4 or 5 indicators, and let's even use that as a basis at a rudimentary level to start thinking of ranking the state of affairs, the state of use of solutions that work in countries. That could be something that you take away from this particular conversation. And, you know, I was one of the co-founders of Transparency International, another ranking thing that made the world to pay attention to corruption and the impact that it has on nations. And I know how far that helped us to bring the topic to the center of the development agenda. Maybe this is time to do exactly that and not wait anymore. That's something that can be done before December, Ebere, don't you think?
It seems like a... It seems like a plot is forming, so that is very good. That sounds thing. And I want to come back to the point, one of the points there, as you were discussing, a very different demographic, very different realities on the continent. And I want to come to the point about evidence, because AI is only as good as the data beneath it. But in many countries, the problem is that local data systems are weak, they're fragmented, they're ignored. And what does it take to get that quality? If AI is built on data that is not relevant or not representative, and I just want to first come to Fenton, that problem of local quality data, why hasn't this been a critical investment up to this point?
I think the challenge is right. As you say, one challenge with AI is that the models are based on the data that the AI has available. And one risk here is that we end up with a world in which AI in healthcare is based on models of Western men and their disease profile and needs and everything else, not the sort of demographic that Obi was describing. I think, and there's lots of other bits of the solution, but I want to go back to one and almost challenge one question you asked, which is, you sort of said, where's the starting point? Or where's the way into this? And I think the way into this was about 6 years ago. And the advantage we have here is that Gen Z, as Obi was saying, are already using these tools. So they're not waiting for us to come up with solutions. They're already using their phones to go and look at ailments they have or look for advice and so on. And when they ask questions of the internet, like, you know, are vaccines safe? They're getting whatever the internet feeds them back. And so I think probably the biggest advantage we have in collecting that data is that there is huge appetite among this young population, which instinctively looks to their smartphones for answers, not to traditional experts or the websites of international organizations. And they're feeding in data every second about their experiences, their interests, what they're feeling, and so on. And if we can find ways to leverage that data that's already coming in, then we can start to build models that are grounded in the reality of a young African continent that's not an aging European one.
Yeah, absolutely. And Kat, I'm imagining this is a reality that you're very much part of. So what can companies like yours do to help accelerate and build the ecosystem to support this rapid collection of the right data?
So I think the notion of data also begins and ends with trust, regardless of how old you are. Making sure that that data is safe, making sure that it's being used for good, right? And so in order to actually have good data and be able to even collect it, you have to have the trust factor there. Once you have that and you have data coming in, I think it's also opening your aperture of what does it mean to have health data. It's not just about health care or when you're sick, but it starts in the home, or it starts wherever you live. It starts in your school, right? It starts everywhere, 80% outside of the clinical settings. And so I think even being able to say, what is the data that a community needs to collect? Is it trustworthy, right? Is it secure? And then from there, when you have that foundation and you know what it is that you're looking at, that's when you could start the conversation about how do you want to use that data. But it also starts upstream with research. It's not just at the end, downstream with the intervention for health and wellness, but how are you making sure that it's equitable as well?
Yeah, absolutely. That question of inclusive data. And I think I'm going to turn to you, Dun, because I know that you're very passionate in this space about inclusion, equity. How can we also persuade the investors to invest in building the kind of data plumbing that we need for this, to really prioritize this in investment?
So I think it's, when it comes to the data plumbing, or if you think about infrastructure, architecture, this is not readily the domain of the investor per se. This is the domain of philanthropy and government. And I think that that's a line we must respect. So I think to expect that investors are going to come in and build this kind of infrastructure, governance frameworks, unrealistic, and we shouldn't try. But of course, there are philanthropists who are interested in doing this, and there are governments, and I think we should learn lessons from when it's been done well. And I think the Singapore government actually has a very shining example of supporting the digital infrastructure and the AI frameworks around the development of AI as well as the scale up. So they actually have a platform that requires patient consultation. They have provided and developed guidelines, so it's called the AI guidelines developed by the Ministry of Health. And actually that's an example that can be used within Singapore, but also across other countries in terms of how do you build that fundamental infrastructure. So I would say let's not ask investors to come into that area. Just a quick one on the data and the use of data in the development of solutions. And I wanted to share two examples of solution providers and kind of how you make sure that your solution is drawing on the right data sets. So there's an AVPN member called Wadhwani AI, and they've developed an AI tool called Shishu Mapan. So it solves the problem. Shishu Mapan means measurement of children, and it solves the problem I was talking about earlier, which is me carrying that clunky weighing scale into the field by actually enabling health workers to take just a video of newborns, and then the video gives you all the anthropometric data, right? And what's really interesting about their solution is that it's also plugged into the Government of India's data dashboard, Anmol. And so before they roll out in a particular state, what Wadhwani AI does is they tune the AI tool with the dashboard data from the state. And so it's drawing on that as a data source. There's another initiative called Arman where they're using predictive AI to boost retention, prevent mothers from dropping out of their M-Mitra program, preventive care mobile health service platform. And again, their predictive model is based on call records, so anonymized call, an analysis of millions of anonymized call records, etc. And then that's the input that's creating the model. So I think there are some really inspiring models to also learn from.
Yeah, every time we discuss the models that these things are happening today. So this is exciting. And I want to...
Susan, I just wanted to build on the point she just made. See, I'm huge on data. As a matter of fact, my creed that I live by is in God I trust. Every other person must bring data, So, I think that it is in this data thing that you said, how it really is not the domain of financiers to finance data development. It takes me back to the importance of partnership mapping. And with the government at the center of it. Every government, everyone that's from government listening to this conversation needs to think of the prior condition for the readiness to maximize AI solution through data availability as something they have to be invested in. To be invested in it means that you've got to think of it. I was Minister of Minerals. And so we didn't just wake up and think, yeah, we've got gold, so come. No, we needed to generate the data that could show you where exactly our airborne geophysical survey was telling you you could find gold. That investment had to be ours before the private sector would then come. It's the same thing for minerals as it is for technology. So data. So what am I saying in effect? Do a partnership mapping. You would find that because partnership for me is the biggest resource that any government has. So do that partnership mapping and you would find where different pockets of data already exist that could also find room in agglomeration. So, but the government has to be at the center of bringing all of this together. And then whatever gap still exists, then of course, government brings some catalytic funding and other philanthropies, because we can again give it to philanthropies alone to sort out the data necessity. But it's absolute necessity if we're going to make the kind of progress that technology would offer us.
I want to offer a slightly cautionary tale here. Government's responsibility is to create an environment where citizens can thrive. And again, I'll use Nigeria because I can criticize my own country. Roads, electricity, access to education, security, considered foundational for any economy, any society to thrive. Nigeria has a culture of entrepreneurship. But governments have the responsibility to create these foundations, and I will now add in digital innovation, AI, as part of that architecture that governments need to create or to be in the forefront of creating for their citizens to then benefit from it, whether it's in business and health and whichever domain. And unfortunately, in too many countries, governments are failing to keep their end of that bargain. And it's not with data, it becomes particularly concerned. We're currently always talking about the extractive industries and how there's, all the terrible conditions of mining for rare minerals, etc. We're at risk of replicating the same thing with the data that's required for AI because there is no regulation. What you described in India is amazing. We are sitting in Nigeria thinking, somebody's going to do it. Our government isn't. And Nigeria is not unique. I'm naming it because I can. If my country asks me, I say, yeah, I voted for you guys, so I can criticize you.
You really voted?
But No, actually, no. I did not vote for the current government. Let it be said that my candidate did not win. But whether I voted for that government or not, it is the government that the country voted for. And it's the same response I give to every time Americans say to me, I didn't vote for the current government. It's your government. So I am responsible. They are my government, so I can create, yeah. So we need to ensure that the regulation is in place to avoid replicating the sort of crisis and catastrophe we're seeing in current, the more physical data industries that are today. And that requires governments to take responsibility, or stand up, and data is the new gold. Everything is going to be running on it. So it's not just your responsibility to make sure it's right and it's properly managed, but it is actually an asset. If you manage it properly, it's an income generation opportunity. So I always keep saying, and the two things I talk about in public health that people say to me, are you a proper public health person? There is no public health without politics. There is no public health without money. That is real. It doesn't matter how good we think what we want to do. It's not going to happen just because it's a good thing to happen. You need the politicians to make it happen and need the resources. So the easiest conversation to have with a politician is saying, it's your job and it can make you money. You tell them it can make you money, they sit up and pay attention, especially in health, because traditionally we see health as, it takes. But if you actually start to tell people, actually, it doesn't just take, but it allows you to generate income, because that health data is going to produce solutions that you can sell to other people and make money, or it will reduce your costs. So we need to come back to, it comes back to what Obi said about advocacy, to push politicians to recognize that we need to move beyond. Roads are still important. There is no data, there's no digital architecture without electricity. But they have got to add in to those foundational responsibilities access to data in a way that is ethical, well-managed, and owned by those whose data it is.
Wonderful. I mean, it doesn't take long for us to get to the stickiness of this, the challenge of this. And I want to turn, just before we open to the floor, we'd love you to start thinking about questions you'd like to put to the panelists. But I'm going to come to you, Fenton, because I've seen you as someone almost being a bit of a genius at becoming that bridge in the middle of this, of someone who sees an opportunity to connect the different interests, the different responsibilities, and to actually make sure that this plumbing is built and happens. What have you learned is the secret to making the system work?
I think there are two themes that have been coming up that answer that. One is partnerships. I think we've talked about the importance of government. We've also, I think, all recognized that government isn't the only piece of the answer. And government's role maybe isn't to innovate here, but is to facilitate the adoption of innovation, to create the environment for innovation, and so on. So I think one bit is about partnership and thinking through. I think one great thing about this panel is we have representation from a whole lot of different organizations representing different parts of the solution, I think. And so what's the right partnership for this? I think the other thing is ambition. And maybe that's the missing piece of the jigsaw at the moment. And just an anecdote, we had this great example of technology for measuring child growth being used in India. And I'm seeing at the same time some of my team who are watching this messaging me saying, we have to go and find out about that and replicate it in the countries. And so I think there are these opportunities that are just sitting there. Most frontline health workers have smartphones. The sort of technology you're describing is something that can be deployed by Christmas. So I think in addition to all of the boring bits, in addition to the partnership, the other ingredient we need in this is ambition to do things quickly. Obi asked us at one point earlier, where's the urgency? The urgency is that people are demanding this right now, and they're looking to technology for solutions, whether they're there or not. And so I think we need to match our ambition with the level of the opportunity that's there.
Fantastic, fantastic. I think this is a good point to go to the floor. Is there anyone? Okay. Yeah. So, it's very difficult in a circle. Okay, can we have a mic here? I'm sorry we won't get to all of the questions, but.
Thank you very much for the opportunity to listen and to ask. I'm from Ukraine. My name is Inna Masinchuk. I'm MedTech Biotech Lead for Ministry of Digital Transformation of Ukraine. I'm not from Africa, but we learn a lot from your experience how to drive the innovations in medical drone delivery. As well, the partnership with African countries is a really high priority for our government. I'm just wondering about the practical use cases, how your government, in which countries, they drive the ecosystem building of startups in the countries, which drive the impact in your countries. So that's some regulatory frameworks, maybe AI policies for them, because the ecosystem building is a so holistic system, you know. And I know that there are so many brilliant minds and brains in Africa which drive these startups. So your experience is so helpful.
Well, yes, please.
The government did pass a Startup Act, and recently also an AI Innovation, an AI Act. So we do have the regulatory, institutional kind of process-led approach to support the emergence of this digital transformation. I think the harder part of it is the technical capacity within government is trailing the speed at which changes are happening with technology overall. And so this gap is a gap that would need to be addressed, because you know clearly that the incentive for working in the public sector is totally different from what drives people to the private sector. And so models of having the private sector lead these kinds of areas in government is one that would be very helpful. And I think that that's where the kind of work you do, you know, really would be helpful. And so when we have these kinds of global conversations, we should look at it as opportunities for saying, if a country, if Kenya, if South Africa, if Tanzania already has the framework, and now it's a matter of the capacity development, the point that you were making, how do we fill that gap in a way that is sustained? And, you know, Ukraine and Africa, we do a lot of things around agriculture and such like. So perhaps this is yet another layer of opportunity for collaboration.
Fantastic.
And I'll just build on that, because it's also about considering the workforce of the future hyper-locally to be skilled up. Let's say AI and obviously other technologies. But there's a huge opportunity, especially because of the youthful generations that are already using it on their cell phone. They already trust, right? And so how do you make sure that there are initiatives and efforts within the up-and-coming workforce that this is part of the skills that they're getting to help with that capacity? So I think that's untapped in a lot of areas right now. We're seeing great strides in it. Africa's leading in upskilling the workforce, particularly on cloud and AI technology. But that's a huge untapped capacity.
It is actually how to make the workforce outside of the regulatory system, because I care about the regulatory system. I know how the bureaucracy can make life impossible for private sector. And with new ideas and new solutions, it's really important that you should have a government that has all the skills to understand it. Otherwise, the regulator ruins the prospects of improvement.
Okay, now, there's so many hands. Do we have a mic? Can we maybe go to this lady here? you. I'm sorry that we could talk for a much longer time, but okay, please, your question.
Thank you very much. My name is Oluwaseun Newton. I'm a medical doctor, but currently doing my master's in Germany here. And my question is that we are asking that women and children be brought to the table for the solutions. I'm taking a look at Nigeria, for example. How do we decide the women to come to the table? Who are we going to bring to the table without leaving other people out? For example, the demographic of Lagos is different from Kaduna or from any other part. So how do we do that nationally and not keep making it into pilot programs if we have to bring everybody to the table? You were talking about that if an app comes to you, it's already late. But how many people do we want to go to bring to the table to consult before we can develop solutions? So that's my question.
It's a practical question. Well, it just happens to be that I am chair of the Women Political Leaders as a flagship organization that brings the presidents that are women, parliamentarians that are women. And one of the studies that we did with King's College London is on representation matters. And so there are models for finding those who are best to sit at a table. In representing. So there are models for it. It's not a problem that is unsolvable. We've got to sort of like get the profile of what it is that people need to be representing at the table. And then do your effort to find them. One of the things we found, Fenton, and you know, you're very, I like Fenton for being very interested. No, I mean it. You know, every time he thinks also of inclusion. He's always promoting the idea of female-led systems and all of that. And what we found is people have a tendency to say, we can't find the women. What do you mean you can't find the women? Excuse me. You can't find the women. You didn't look. You know. So in those kinds of understanding that representation matters, you must find the women because they are there, and you must find the right kinds of women who would not just be happy to be at the table and not realizing that they are the menu on the table. You know, so you've got to find them. And a second point that you made is a very important one, which is when the women come to the table, who is bringing them? And that's the convening power thing, right? We need to understand convening power. Sometimes convening power to bring multiple stakeholders to the table is not government, because they're not influential enough. They have trust deficit. And so there are some people they ask to come to the table and they say, who? No, I'm not coming. So you've got to find the really influential people on this kind of topic and bring them together with government. And that's something that takes time. You know, building partnership takes time. Fenton, I'm sure you know that. In the world of development, finding people to say, okay, we're going to come together and we'll all solve a problem, it takes time. You've got to invest money, you've got to invest time, you've got to invest knowledge into it. And who exactly should we identify would be best to do this for this kind of a topic that we're addressing? That's the big question.
No, absolutely. And unfortunately, time is my enemy right now. So, and I would love to go to the floor again, but I also want us to hold this panel accountable. And we are not letting them out of this room unless they make a commitment for how we can take this discussion forward, some follow-up action, something concrete, so that we can walk out and know that we made a little dent in the universe today. So I would love to go around. I'm going to go start with Dun this time and come around this way. You have roughly a minute each to make a commitment.
So I think, AVPN in its DNA is a network organization, and so we bring people together. So you're right, and I think that's absolutely important to draw on that convening power to not just stimulate the right conversations, but to help translate those conversations and intentions into action. And so, open invitation to anybody who would like to work with us. Please do come speak with me, speak with us. We'd be happy to co-create and see how best our convening power can help move solutions along.
Wonderful. Wonderful.
I would say at this moment in time, the world more than ever needs the commitments to be stronger and not weaker, to impact lives in some of the most complex issues, health being one of them, education being another one, climate being another. I would invite everyone on this panel, plus those that are actually leading work at the continental level, at the country level, to help us understand what you're working backwards from so we can bring it to life with technology as enabler, not the solution. Hyper-locally for what matters in each of your geographic areas.
Thank you. And we'll very much find a way to follow up with that. Fenton.
We're going to do lots of things on this, but I think if I had to pick out one, it would be helping raise the level of ambition. And I think one way we can do that is by looking at the examples where technology or AI are already being used to change lives, like some of the ones that we've heard around the group today, and drawing attention to those, bringing them into the eyes of policymakers and leaders in systems, and helping raise the level of ambition about what we can do and how quickly we can do it.
Thank you.
I have two things to offer. So the first one is, starting tomorrow is the Africa Health Technology Summit in Kigali. I know some of you are here, but there's a direct flight between, I think, Frankfurt to Kigali if you decide to hop along. But it's also been live streamed, so you can follow some of that conversation. That is now in its 4th year and has been a very, very influential convening for addressing technological solutions to or contributions to African priorities. So I would encourage you to look to that forum if you can. And then the other side of things is we need to continue to advocate for women to be front and center in deciding and defining and developing these solutions. And my commitment is, I've never been known to pass up the opportunity at a mic to talk about women in leadership. And my commitment is I will continue to do that as noisily and aggressively and constructively and positively as I can. Just there was a comment there about table and bringing to it. There isn't a singular table. There are loads of tables, and where there is no table, we will build one. The important thing is to, if you're in a position to be a thought leader in your whichever convening, whichever space you occupy, use it. Generate the understanding of what the needs are from the perspective of whoever your constituency are, and feed that into the chain. The more we have the conversation, the more likely we are to get to understand the real challenges and the real opportunities that exist. I don't believe there is any solution to any health challenge that doesn't already exist in some form. We just haven't heard it yet. So we all have that responsibility to use whatever platform, whatever forum we have to ask the questions, to gather information, and to feed it into the next bit on the chain that we are part of. Thank you.
So my commitment would be, one, raise the political salience of this topic and use all that I am connected to. It is good that I can tell a president in Africa, you're failing. You need to stop failing. And to say to them that there's a fierce sense of urgency because you don't want a double track of the failure that we have seen, where we're trying to catch up with existing models of development, and now another layer has come and we still are not ready. So whether it's at the African Union or it's at the ECOWAS or country specific, I do have leverage. And so I'm going to use that even more. My number two is that when it comes to the matter of building this demand side for better, it's something that naturally comes to me. I do not believe in learned helplessness of citizens, where citizens just look at themselves and think we're pitiful. And the people in power have the right to ride roughshod over us. I have a problem with that. So I will continue to use my voice to elevate the power of citizens, that office of citizens, to demand for better. And we need that now in order for this to work. And my third point is, as one who
really amazing panelists, that we've really we've leveraged some convening power. We've managed to, I hope, raise the level of ambition. We're going to use our political leverage, and we're going to harness the demand that's coming from our citizens. So with that, I thank you all for a wonderful 90 minutes.
Thank you too.